I welcome you all to this presentation, which is actually co-authored by Robert Jacob from the World Health Organization, WHO. And unfortunately, he cannot attend because we have another WHO meeting just in parallel to this. But anyway, I want to talk a little bit on emergency informatics systems, and in particular, the digital health in the early rescue change and information exchange in that field. And we will see that terminologies and standards are needed in that field, still needed. So for introduction, I would like to refer to some statements and guidelines from the United Nations. So the UN in 2015 delivered the Agenda for Sustainable Development, and one goal here is to ensure healthy life and promoting well-being for all people and all ages. WHO actually has the 13th General Program, also with similar goals, and in particular, they've worked the triple billion targets for 2023, where we want to achieve a universal health coverage, addressing health emergency and promoting healthier population. And there was just recently released the WHO Global Strategy on Digital Health, with one focus being cost-effective and efficient health systems. And so if we look to these goals, I think actually emergency and how emergencies are treated can be substantially improved by using e-health technologies and computer science technologies. And this is what we put actually in the terminology accident and emergency informatics. So it could be seen as a sort of science of systematically capturing medical data and environmental data, integrate this data with respect to syntax and semantics, and then provide analytics on this joint data in order to predict adverse events before they happen, or avoid actually them, or lower their impact. Now that is basically the goal. Here are some additional links to websites, and the medical data, which is meant here next to the environmental data, is also defined by WHO with their papers on quality of life. So we need to capture behavioral, for instance, mobility, physiological data, which may be vital signs, but also psychological data. So for instance, anxiety or depression or things like that. And one particular example on information exchange in the early rescue change is the eCall system. eCall was decided by the European Union in 2015, such that with the April of 2018, all new cars in the European Union must have this eCall system, which automatically detects some traffic accident, basically using the airbag sensors, so environmental sensors, then establishing a phone line and transmit some minimal set of data, such as GPS coordinates from the event, the type of car, type of fuel the car is driven, and so on. But then, however, the response is manual. So there's operator talking with the phone line into the car. If there is no response from the occupants, the emergency is sent out. A similar thing is Apple smartwatch. If the smartwatch detects the fall, which is done automatically using acceleration sensors, again, some environmental or behavioral sensors, and then there is here a display. You can resume. If you're not acting on this message, an SOS call will be sent with the GPS coordinates. So very similar, but then the response again is manual. And what we are thinking of is future systems where this communication is completely automatical. So there will be in apartments, in cars, if there is nobody responding, there is a need to exchange information. And what we have as a state of the art is ECD 11. So just a new revision was given a couple of weeks ago from 2020. And if we look inside, there is, for instance, chapter 22 describing injury, positions, and so on. And we also have these extension codes, which are good for the dimension of injury, where it was placed, and so on. But a lot of information that is required for the rescue team cannot be covered with ICD 11. So defining the need. Why do we need more standards and terminologies in these early rescue chain? So we look to smart environments such as home, cars, wearables, and the Internet of Things, smartwatch, smart ladder. There will be a ladder, detecting a fall from the highest ladder, and maybe being able to send a rescue call. And we also have the Internet of Medical Things, for instance, wearables, 5G communication, and so on. And the question is how we can develop a rescue and communication between the systems without any human in the loop. So the systems involved are these alerting systems: smart home, smart car, smart wearable, Internet of Things. We have the responding systems, for instance, the triage, disposition, rescue team with land, air, or water, and the curing systems, the hospital. So emergency rooms, chest pain, stroke units, whatever. And these systems, at least in Germany and the most parts of Europe, they are standalone. They do not exchange any data yet. And in particular, here, I think this will be the future, where the alerting system and the responding system need to communicate. In Germany, we learn at school the triple W. So, wo, was, wie viel, which means what have happened, where it has happened, and how many injured. So the where it has happened will not be only the GPS coordinates as we have it in the systems right now. It will be also some semantic location like address, building part, level, room, and also smart navigation, how to get to the specific room in a complex building or in a complex of buildings. What has happened? It's not only that there's a traffic accident. We need to code all types of health-related issues that could be detected automatically by these smart devices, Internet of Medical Things, and others. And then how many people are injured? So it's not only the number. Maybe we should provide access to additional medical information on a particular individuals, so previous issues, current measurements, and so on. That all needs to be transferred, and based on that, we suggest a minimum data set with an event identifier, the time, location, type, and the victims involved. And that brings me to the proposal of an international standard accident number. We already modeled this number, so time, and what is also important, time uncertainty, location and location uncertainty. This all is merged together in combination with a unique identifier, such as the media access control, so the MAC address, or the International Mobile Equipment Identifier, just to make sure that the ESA number itself is unique. We can provide eSign services based on web technology. So for instance, location and uncertainty may give the range. You can compare two of these numbers in order to decide whether it could be that it is the same event described from one car and the other car crashing into each other and things like that. There is a small video just to emphasize what we think is the future. So this is an apartment, a young man, and he has a muscle disease, standing up, falling down, hurting his skull, and then what happens? Nobody is in the apartment. The apartment sends a rescue call and gives additional information which is exchanged between the systems. For instance, door opening code here, in this example, the floor map in this example, and indicate the room where the patient can be found. Yeah, and then the video goes further, showing that there is information that can be transferred between the rescue team and the hospital or the emergency room in the hospital. So I will shorten this here, but the one thing we had is the navigation. So for instance, this is a campus map of the Hanover Medical School, a lot of buildings. It has all one street address. It's a huge area. So if something happened, street address is not enough. You need to guide the people to the event. Where is the event located and how to get there best. Same, for instance, if you have a pileup. The first rescue team arriving in this situation needs to decide which car needs first the help. However, the cars interconnected to each other, they know about the mechanical instances and can decide on that. And the example with a floor map and also vehicle rescue sheets. This all needs further standardization, international standardization, in order to guide the early rescue chain. So with respect to the event type, we can use ECD-11. And with respect to the victims, still there is a master patient index not really existing in all countries in the world, including Germany. We are far behind the international development in these parts. Also with electronic health records, and access to electronic health records. But from our idea, the eSign number would be providing methods and mean in order to do that. And since we are already good in time, I want to give you some take-home messages. So the first is WHO quality of life has basically 4 parts. Actually, they define 6 parts: religion and self-satisfactory. But there are 4 parts which can be good assessed with sensors. So that is environmental, behavioral, physiological, and psychological parameters. And we are developing smart devices that will allow us to continuously monitor these parameters. And based on this continuous monitoring, these smart devices will create fully automatic health alerts. And we need to answer these fully automatic health alerts. And in order to do that, the emergency information systems still need terminologies and standards for location, site maps, floor plans, rescue sheets, as well as the navigation, and also for the victim identifier, how to access health records, how to transfer vital signs acquired during the first responses, and also the event forces, so the mechanical things that yield the injury. And that's already the end of my talk. I thank you very much for your attention.